Good afternoon. Oops, that's mic'd, it's on. Thank you for coming here this afternoon and engaging us and allowing us to share our story with you in this very intimate setting. But before we begin and introduce ourselves, I just wanted to take a second to acknowledge our faculty. In this non-traditional class, we had not only the luxury, but the privilege to be taught from a variety of different leaders, as well as our own faculty here at UNE. So very briefly, Ms. Mary Creighton, who was an elder at the Passamaquoddy community, Ms. Holly DeYoung, who's the CEO of the Eastport Healthcare up there, Ms. Vera Francis, who's an advocate for the Passamaquoddy community, Dr. Karen Houseknecht from pharmacy. Do you want to stand up just for a little acknowledgement? Professor Kelly Johnson, who's a counselor here at this, at UNE. Professor Adrian McCauley at the Department for Doctor of Physical Therapy. Professor Joe Wolfberg at the PA Department. And Professor Ann Zill, who's the director of the UNE Art Gallery. So before we present our presentation for you briefly, my name's Chris and I'm from the PA.
I'm Dan Johnson, I'm from physical therapy.
I'm Peter, I'm from College of Pharmacy. I have a test, I'm sorry, my mind. I have a test in a couple of hours.
I'm Lisa, I'm from the social work program.
And I'm Charity from the College of Pharmacy.
I'm Kate from the PA program. So we'll go ahead and start the presentation. So we just put together a little slideshow for you up here so you can have a visual. But I'll start by explaining what we did before the trip to prepare for it. So just a quick overview. In January, we got together for a week. And the title of the course was Cultural Competency in Healthcare. So we met at the art gallery, which there's a picture of in the upper left-hand corner. So it's a different space for most of us to get together in the academic setting. And also an evening in February, we discussed cultural sensitivity and health disparities. So we did it in a variety of ways. We got to know each other. We read and discussed books, some of which are up there. We wrote poetry. We watched documentaries. We looked at art. So we just tried to prepare in various ways for this trip up to Washington County, Maine, where there would be a visit to the Passamaquoddy Reservation, the Eastport Health Clinic, and other community happenings. So this presentation is structured as a way to share the experience with you. We each chose a word, a quote, or an idea that we felt represented how it was meaningful to us.
I chose the word community because the class was made up of students from different programs who came together to form one community. And in our community, we listened, shared stories, and in turn built relationships. And in turn, sharing the stories, we all realized that even though we came from different backgrounds and different programs, our stories were very similar. And I like the quote, which I chose by Molly Marty, which says, as part of humanity, each of us is called to develop and share the unique gifts that we're given.
The word I chose was whole. So whether we're on the practicing or receiving end of healthcare, I think our whole human experience is very important to that. And one way that we started out with the wholeness was in creating life maps. So to acknowledge our own wholeness and to get to know each other, we either brought in drawings, created collages, brought in music or belongings, different ways of sharing our whole stories with each other as a starting point.
We watched documentaries and we read books, and then we sat together and talked about the challenges that each of the communities were facing. And I picked the pictures of the documentaries, and Bad Sugar was about the disenfranchised people in the Tohono O'odham Nation in Arizona, and the high prevalence of diabetes among them. And then not just a paycheck is about the employees that were left from the Electrolux company when they moved from Greenville, Michigan to New Mexico. They just left their employees with no money, and then the health just deteriorated after that. And then when the bowl breaks, talks about it taught us how racism throughout the lifetime of an African American woman impacts pregnancy outcomes.
So something that sort of paralleled my experience, which maybe a lot of you know, is the parable of the elephant, and then the people that go in the dark room and they try to figure out what is in the dark room. They don't know it's an elephant. So depending on which piece of the elephant they came in contact with, they thought they could figure out what it was. So you can see from the picture, the person that touched this tusk thought it was a spear. The person that touched the trunk thought it was a snake. The tail, the rope. They touched his leg. They thought it was a tree, etc. So that reminded me of how we all came together for a course about health disparities and cultural sensitivity. We're each from a different program. Well, some of us are from the same program, but there's a lot of different programs represented to come together to a more whole perspective on healthcare. So our group was made up of faculty members, as Chris said, from PT, PA, pharmacy, the art gallery director, a provider from the health center, and then the students were from the pharmacy, PT, social work, and PA programs. So I think that working together enriched all of our perspectives.
This was crucial because in order to meet the needs of the people, it's important to incorporate the beliefs and cultures of the diverse communities. We also learned that healthcare is now trending towards being culturally appropriate and flexible to meet the needs of the community.
I chose the words being present to describe my experience of this whole course, and I found this quote by Maya Angelou: "Be present in all things and thankful for all things." I think that this quote is so powerful. I am thankful for all the things that we encountered during this course and this cultural immersion experience. And I feel that being present in all things is so important for the work that we do with our clients and for life in general. I think that my classmates and I were present for each other, beginning with our classroom time in the art gallery, and continue to be present for each other and for each person we met in the Eastport community. Now I'll look at a couple different perspectives on being present and describe a personal experience of it. In her TED Talk, Being Present, Elizabeth Acevedo states, "Being present doesn't have to be about grand gestures. It can be something as simple as asking someone, 'How are you?' and actually listening to their response. Speaking to someone and trying to get to know them. Seeing the people walking alongside you and actually seeing and feeling them and know they are here with you." Peter Russell defines 3 principal ways in which people use this term, being present. First, living for today, not worrying about what happened yesterday, nor about what might come tomorrow. This attitude definitely has its value. It may help us take life as it comes and not get so caught up in unnecessary fears and concerns. It allows us to enjoy more of what life has to offer. But it does not necessarily lead to a fuller awareness of the present moment. One may still be as caught up in thoughts as before, even if they be thoughts of today rather than yesterday or tomorrow. Number 2, awareness of present experience. This is the starting point for a number of meditation practices. Whereas most of our thoughts are about the past or the future, our sensory experience is always now. Thus, many spiritual teachers advocate placing the attention on bodily sensations, points of contact with the physical world, the heartbeat, or the breath. The actual feelings in the body are in the present moment. Then, when the mind wanders off into some thought about the past or future, as it surely will, gently return the attention to physical sensations, and so back to the present. And third, being at ease with everything. This often comes as the result of the long-term practice of meditation. There is no longer the need to keep the attention to sensory experience. One is present to whatever is, including the arising and passing of thoughts about the past or future. It simply is as it is. My experience of being present happened on our first night in Eastport. We were invited by the Passamaquoddy to a full moon ceremony at Split Rock, which is sacred land along the water at Pleasant Point Reservation. For the Passamaquoddy, the full moon is their grandmother. And monthly, during every full moon, they hold this ceremony full of singing and drum playing around a bonfire to honor grandmother. When one of the women, Loretta, introduced herself to me, I told her that Loretta was my mother's name. And when I introduced myself to her, she told me that Lisa is her sister's name. I felt an immediate connection to her. Next, she offered me her drum to play in the ceremony and told me to play from my heart. She was asking me to listen and to feel my heartbeat and play it. Paying such close attention to my bodily sensations and accepting her gift without fear allowed me to be in the present moment. Being asked to be a part of the ceremony was such an incredible honor, and being asked to play Loretta's drums was such an extraordinary gift. After this ceremony, I had a sense of peace and energy that I've never felt before. Being immersed so fully in the culture of the Passamaquoddy was a perfect way to start our journey in Eastport.
Perspective. This word came to mind as I was reflecting on my cultural immersion experience. The experience alone was one of my many highlights of my young pharmacy career. As I look back on the experience, the notion of cultural immersion seems a little bit more clear. Perspective to me has always meant seeing things from one's own point of view. My initial perception upon visiting Eastport was it's a very small town. Fun fact, it actually only has only stop signs, no streetlights, which was perplexing considering I grew up in a big city of Houston, Texas, where there's probably over 5,000 streetlights. I had never experienced being in such a small town before. I was very curious to see how things were ran over there, more specifically healthcare, and how it pertains to such a small town. While in Eastport, I got a chance to explore the geography over there, meet some of the locals, and more importantly, engage in understanding the culture in Eastport. Perspective, growing up, I always thought that it allows you to realize that people are truly different and alike at the exact same time. The core foundations in Eastport are centered around community and cohesiveness. This is a true testament to how the school system was ran over there, along with the home-centered healthcare model. The incorporation of community to the success of these systems proved to be invaluable. From the nurses to the grade school teachers to the principals to the museum director and the hospital director, all of these individuals helped shape and had an extremely abundance of influence on the way those systems were ran. Understanding the people of Eastport was essential to understanding the culture of the town. Health is universal. In fact, health is universal in the fact that everyone has it. Enjoying life is universal in the fact that everyone should experience it. The purpose for me for going to Eastport was to experience a true hands-on learning experience that cultivated a different type of culture. I truly feel healthcare practice and understanding culture are synonymous. These two principles are very important in promoting an atmosphere of trust in the healthcare system. As I move forward in my pharmacy career, there's not a day that goes by that I don't use my past experience to help me in my future endeavors. I'm a lifelong learner and truly inspire myself to learn new cultures and new things every day by bettering myself. The overall culture immersion experience was very rewarding and truly inspiring. That's a picture of Campobello Island. We were by a lobster, what was it? A lobster prom. And that's a quote I'll leave you guys with. The quote is from a musician by NDRE. It's titled, "Life is a journey, not a destination. There are no mistakes, just chances we've taken. Lay down your regrets, because all we have is now."
Okay, the reason why I wanted to be involved in this project is because since I was a little kid, I was always interested in Native American cultures. So when I found out that I had a chance to visit the Passamaquoddy Reservation, I jumped at the chance. In early January, when we first started to meet, some of the projects that we had to do that Charity and Kate talked about before, one of them was to read an article on the Lakota Reservation at Pine Point in South Dakota. So I decided to tailor my part of the presentation, give you a little bit of history, a very small amount of history. If I was to talk about all of the history with the Sioux Lakota Nation, it would probably take up an hour and more. So I'm going to give you a little bit of snippet, and then I'd like to talk about some of the psychological implications and the implications on healthcare. So this picture here is the Black Hills. Black Hills is considered sacred to the Lakota, Northern Cheyenne, and Omaha tribes. Lakota refer to the Black Hills as Pahasapa, the heart of everything there is. So in their religious tradition, they believe that the Lakota literally sprung from the ground, or Mother Earth, in the Black Hills. So a good parallel to that is if you think about the Christian tradition, the Garden of Eden. This is their Garden of Eden. And that's important to keep in mind as I go further. In 1886, the U.S. government and members of the Lakota signed the Fort Laramie Treaty of 1868. Provisions in the treaty exempted the Black Hills from white settlement forever. 6 years later, things changed quite a bit when General George Custer's Black Hills expedition found gold on Lakota land. This resulted in the U.S. government violating the conditions of the Fort Laramie Treaty and driving the Lakota out of the sacred Black Hills. The resulting gold rush brought thousands of miners to the Black Hills, along with settlers founding the towns of Deadwood, Central City, Lead, Hill City, and Custer City. From 1880 on, it is estimated that the mining in the Black Hills yielded about $4 million in gold and $3 million in silver annually. When most Americans think of the Black Hills, they think of Mount Rushmore, which is actually on what is supposed to be Lakota land. This is a huge offense to have the four of these men up here, and I'm going to demonstrate why. In 1779, George Washington instructed Major General John Sullivan to attack the Iroquois people. Washington stated, "Lay waste to all the settlements around, that the country may not merely be overrun, but destroyed." In the course of the carnage and annihilation of the Indian people, Washington also instructed his general not to listen to any overture of peace before the total ruin of their settlements is effected. In 1807, Thomas Jefferson instructed his War Department that should any Indians resist against Americans stealing Indian lands, the Indian resistance must be met with the hatchet. And if ever we are constrained to lift the hatchet against any tribe, he wrote, we will never lay it down till that tribe is exterminated or is driven beyond the Mississippi. Jefferson continued, in war, they will kill some of us, we shall destroy all of them. Theodore Roosevelt is quoted as saying, I don't go so far as to think that the only good Indians are dead Indians, but I believe 9 out of 10 are, and I shouldn't like to inquire too closely into the case of the 10th. In 1862, President Abraham Lincoln ordered the execution by hanging of 38 Lakota Sioux prisoners at Mankato, Minnesota. Most of these were executed were holy men or political leaders of their camps. None of them were responsible for committing any of the crimes they were accused of. It is coined as the largest mass execution in U.S. history. Abraham Lincoln also appointed this man, General John Pope, to deal with what they called during the time as the Indian problem. And General John Pope, upon his nomination, said, "It is my purpose to utterly exterminate the Sioux. They are to be treated as maniacs or wild beasts, and by no means as people with whom treaties or compromises can be made." On July 23rd, 1980, the Supreme Court of the United States ruled that the Black Hills were illegally taken and that remuneration of the initial offering price plus interest, nearly $106 million, be paid. The Lakota refused the settlement as they wanted the Black Hills returned to them. The money remains in an interest-bearing account, which now amounts to over $757 million, but the Lakota still refuse to take the money. They believe that accepting the settlement would allow the U.S. government to justify taking ownership of the Black Hills. And I found this quote, which I think sums up their position on the issue, by Rick Two Dogs. "All of our origin stories go back to this place. We have a spiritual connection to the Black Hills that can't be sold. I don't think I could face the Creator with an open heart if I ever took money for it." Now here are some statistics on the Pine Ridge Reservation. So if you guys just want to take a couple seconds and think about where you grew up and where you live now, maybe, before I go into this, and then when I start, try to imagine if you lived on the Pine Ridge Reservation. So from 1980 to 2000, the counties that make up Pine Ridge Indian Reservation in South Dakota comprise the poorest of our nation's 3,143 counties. The 2000 census found them to be the third poorest, but not because things got better on Pine Ridge, but because things got worse on 2 other South Dakota Indian reservations. Population is approximately 38,000, with an unemployment rate of 80 to 90%. Annual per capita income is $4,000. Suicide rate is more than double the national average. Teen suicide rate is 4 times the national average. Life expectancy on Pine Ridge Reservation is the lowest in the United States and second lowest in the Western Hemisphere. It is 48 for males, 52 for females. Only Haiti has a lower rate. Diabetes is 800% the national rate. 50% of adults over 40 are diagnosed with diabetes. Cervical cancer, 500%. Heart disease, 200%. Tuberculosis, 800%. Alcoholism is estimated as high as 80%. 1 in 4 children are born with fetal alcohol syndrome or other alcohol-related birth defects. Infant mortality rate is 300% the national rate. The closest sizable town, with approximately 57,000 residents, so almost the same size as Portland, is Rapid City, South Dakota, which is 120 miles from Pine Ridge. The closest big city is Denver, which is 350 miles from Pine Ridge, so quite a bit isolated. It is reported that at least 60% of the homes have black mold. This infestation causes often fatal conditions with infants, children, elderly, those with damaged immune systems, and those with lung and pulmonary conditions at the highest risk. Exposure to this mold can cause hemorrhaging of the lungs and brain, as well as cancer. A federal commodity food program is active but supplies mostly inappropriate foods, those that are high in carbohydrate or sugar, for the largely diabetic population of the reservation. Many reservation residents live without health care due to vast travel distances involved in accessing that care. Additional factors include underfunded, understaffed medical facilities and outdated or non-existent medical equipment. In most of the treaties between the U.S. government and Indian nations, the U.S. government agreed to provide adequate medical care for Indians in return for vast quantities of land. The IHS was set up to administer the health care for Indians under these treaties and receives an appropriation each year to fund Indian health care. Unfortunately, the appropriation is very small compared to the need, and there's little hope for increased funding from Congress. The IHS is understaffed and ill-equipped and can't possibly address the needs of the Indian communities. Nowhere is this more apparent than on the Pine Ridge Reservation. The school dropout rate is over 70%. According to the BIA report, Pine Ridge Reservation schools are in the bottom 10% of school funding by the U.S. Department of Education and the Bureau of Indian Affairs. Teacher turnover rate is 800% the national average. There is an estimated average of 17 people living in each family home, a home which may only have 2 or 3 rooms. Some larger homes built for 6 to 8 people have up to 30 people living in them. 59% of the reservation homes are substandard, Over 33% lack basic water and sewage systems. Many residents get their daily water from rivers. Some reservation families are forced to sleep on dirt floors. Without basic insulation or central heating in their homes, many residents on Pine Ridge use their ovens to heat their homes. Periodically, reservation residents are found dead from hypothermia. It is reported that at least 60% of the homes on Pine Ridge Reservation need to be burned to the ground and replaced with new housing due to infestation of the fatal black mold. There is no insurance or government program to assist families in replacing their homes. 39% of the homes on Pine Ridge Reservation have no electricity. Federal and tribal heat assistance programs, such as LLEAP, are limited by their funding. In the winter of 2005 to 2006, the average one-time only payment to family was said to be approximately $250 to $300 to cover the entire winter. For many, that amount did not even fill their propane heating tanks one time. Weather is extreme on the reservation. Severe winds are always a factor. Traditionally, the summer temperatures reach well over 110 degrees Fahrenheit, and winters bring bitter cold with temperatures that can reach -50. Flooding, tornadoes, or wildfires are always a risk. The Pine Ridge Reservation still has no banks, discount stores, or movie theaters. It has only one grocery store of any moderate size and is located in the village of Pine Ridge on the reservation. Several of the banks and lending institutions nearest to the reservation have been targeted for an investigation of fraudulent, predatory lending practices with the citizens of Pine Ridge Reservation as their victims. Transportation, there is none. No public transportation. A minority of reservation residents have an operable automobile, so most people just get around by walking or hitchhiking. Alcohol. The death rate from alcohol-related problems on the reservation is 300% higher than the remaining U.S. population. The Oglala Lakota Nation has prohibited the sale and possession of alcohol on the Pine Ridge Reservation since the early 1970s. However, the town of White Clay, Nebraska, which sits 400 yards off the reservation border in a contested buffer zone, has approximately 14 residents and 4 liquor stores, which sell over 4.1 million cans of beer each year, resulting in a $3 million annual trade. Unlike other Nebraska communities, White Clay exists only to sell liquor and make money. It has no schools, no churches, no civic organizations, no parks, no benches, no public bathrooms, no fire service, no law enforcement. Tribal officials have repeatedly pleaded with the state of Nebraska to close these liquor stores or enforce the state laws regulating liquor stores, but have been consistently refused. Scientific studies show that the High Plains Oglala Aquifer, which begins underneath the Pine Ridge Reservation, is predicted to run dry in less than 30 years due to commercial interest use and dryland farming in numerous states south of the reservation. This critical North American underground water source is not renewable at anything near the present consumption rate. The recent years of drought have simply accelerated the problem. And I added some pictures to show what it's like. I found this quote by Sitting Bull, who was chief of the Lakota when the Fort Laramie Treaty was signed. Let us put our minds together and see what life we can make for our children.
So unlike my colleagues, I couldn't come up with a quotation or word that really encapsulated how I felt my time up in Eastport and on the Passamaquoddy Reservation. However, there was one specific moment in time that struck me the most and had the most profound effect upon me. And it was on our last day when we met with Vera and Mary, and we had the honor to sit down and hear Dwayne, who's a member of the Passamaquoddy tribe, and he recited a speech by Lewis Mitchell in 1887 that was given before the Maine legislature. And personally, growing up in elementary and secondary education, you hear, or I've heard, of Indian atrocities, but it's such a general, vague, oversimplified capturing of history. But when he recited this, it really brought it home, and it had and still has an effect on me every time I look through it. So I wanted to go ahead and recite Lois Mitchell's speech to the 63rd legislature in 1887. I was authorized by the Passamaquoddy tribe of Indians to come here before you for the purpose of making known to you what the Passamaquoddy Indians have done for the American people, and how we have been used by the American people, and how we have used them. In 1775 or 1776, in the struggle between Great Britain and America, your people came to us for assistance. You authorized Colonel John Allen to speak to us, and you said, "He is our mouth. Believe what he says to you." After many kind words and promises, Francis Joseph, who was the chief of the tribe at that time, accepted this offer. He promised to go and help his people gain their independence. Immediately, he sent his captains to different parts of the country to notify his people to prepare for immediate war. In a few days, Francis Joseph gathered an army of 600 men. At that time, and many years before that, the Passamaquoddy tribe was the headquarters of the Abenaki Nation. Passamaquoddy tribe can show you by a letter of Colonel John Allen when he authorized the Passamaquoddy Indians to guard coast formed Machias to Passamaquoddy and authorized them to seize the enemy's vessels. And according to his orders, we can show you by affidavit Captain Sopio Saktoma with 50 others of his tribe captured an armored schooner in Passamaquoddy Bay, and they ran her to Machias and gave her up to Colonel John Allen. We know the Indians who served in that war are passed out of our existence, but the Passamaquoddy tribe helped the Americans in that war, and the tribe is still in existence. Now we bountifully ask your attention to help us by letting this legislature examine the papers and refer them to Congress if they see fit. In the treaties of 1725, 1794, and Governor Dumner's Treaty of 1727, and in the laws of Massachusetts and Maine at their separation, we were guaranteed the right to hunt and fish forever. In the year 1854 or 1857, some dishonest person or persons presented a petition to Maine legislature asking the state to sell the Indians' land. Indians did not need it, so the legislature passed a resolve that a certain piece of land situated in the town of Perry, owned by the Indians, would be sold by public auction. On such day, at Perry, they must have arranged everything so they wouldn't bid against each other, and the land was sold for the sum of $500. The Indians opposed the sale of it. Now, their firewood cost the Indians a Pleasant Point $1,500 a year. If that land had not been sold, the Indians would not suffer for want of firewood. Thousands of cords of cordwood have been cut, and wood is on it yet. The land cleared by the Indians was also sold. Now we claim again that this is not right. An Indian agent himself brought this land again afterward and again when we lost the claim on the lands, the case Granger versus Indians. We not only lost his claim, but $2,500 of the Indians in favor of Mr. Granger. Just consider how many rich men there are in Calais, in St. Stephen, Milltown, Machias, East Machias, Columbia, Cherryfield, and other lumbering towns. We see a good many of them worth thousands and even millions of dollars. We ask ourselves how they make most of their money. Answer is, they make it on the lumber or timber once owned by the Passamaquoddy Indians. How many of their privileges have been broken? How many of their lands have been taken away from them by the authority of the state? Now, we say to ourselves, these Indians ought to have everything they ask for. They deserve assistance. We are sent here to help the poor and defend their rights. Now, this plainly shows us how much worse a people of 530 souls are, stripped of their whole country, their privileges on which they depend for their living, all the land they claim to own now being only 10 acres, If 1 or 2 men in this body were Indians, they would fight like braves for their rights. Now look at yourselves and see whether I am right or wrong. If you find any insulting language in my speech, I ask your pardon. I do not mean to insult anybody, but simply tell you of your wrong. Dwayne, who was the community member who recited this speech, had such a spirit about him, and as well as Mary and Vera, their own distinct spirits, but you could hear the pain in their voices and the historical trauma, which was really brought around for me full circle when we first started the class and we watched the documentaries and talked about historical trauma through the readings that we had. And then at the very last day, having this recited to us was probably the most profound part and really brought everything full circle, like I said, for me and if I dare to say, by all my classmates. And so thank you, and that's our presentation.
Are there any questions? Okay. Sure.
On all channels, I guess. Does anybody else have a memory of a moment or an extended moment or an experience where you felt, wow, I am really here and this is it?
Well, I knew I was really there when we were there the first night. It was cold. It was like, it was extremely cold. I had never been somewhere. It was negative 12. It was negative 12. So that was present definitely. But outside of that, the experience being outside, I had never experienced that before with the full moon. So that was different. That was definitely in the moment as far as everybody being together for one cause. So that was interesting. They're good. Any more questions?
Thank
Adrian?
you all so much. Each of you sort of alluded to it in your own way, but I'm wondering if, in a couple words, you might be explicit about how this impacts you as a healthcare provider and what you might share with students who would consider this in the future as to whether they might choose this experience.
Go for it. You want to go first? I'll go. Okay, I'll go. I think for anybody in any profession, doesn't matter. I think understanding somebody else's point of view, whether or not you truly understand it, but just understanding that their point of view won't directly be just like your point of view. And it can come from so many different areas, how they grew up, where they grew up, you know, anything of that sort. But just understanding that will kind of help them make their healthcare experience a little bit more better and a little bit more understanding as far as both the patient and the healthcare practitioner on the same page, just so they can, to be honest, just feel comfortable, honestly, you know? So that's the way I look at it. And the experience with this class, I would recommend it to somebody else for the fact that you get a chance to meet wonderful people, wonderful faculty, and I think experiencing something new. I think we're all in a situation where we constantly want to learn and better ourselves, and this experience alone has definitely helped me do that.
Yeah, so as far as whether I would recommend it to somebody else, I think I would first ask them what they would be looking to get out of it, and then try to address their question from there, whether or not I felt that that would meet their needs. But yeah, it was definitely a great experience. We didn't really get a chance to talk about everything that we did. One of my favorite parts of the trip was when we went to the Perry Elementary School, and we broke up into groups, and two of us did a talk on bullying, and Chris and I did a talk on, you know, what we're going to school for, and asked the kids what do they want to be when they grow up, and we spent a good, I don't know, half hour with each class, and it was it was tough to describe the difference to a 4-year-old between a PT and a PA and what we do. But it was good to kind of see the kids' wheels turning and thinking about, oh yeah, maybe I could do something like that. And the one girl, I think it was 4th grade, when we were asking what they want to be, I think it was 4th grade, she raised her hand. She's like, I want to be a cardiovascular surgeon. I was like, all right. I don't even know what that was when I was 18, let alone in 4th grade.
Personally, I've had been fortunate enough to be exposed to other cultures, and there's a common thread that I have found with all of those cultures, but in particular to being exposed to the Passamaquoddy and the culture of down East Maine in general. When the veil's been lifted, and I can't just simply walk away because now I'm culpable. In essence, if I weren't to do something in some sort of aspect or fashion, it would be taking this experience and just washing it down the toilet. And so that's something I've been chewing on since we've been back, and something I will continue to think about. But something will be done in the future for healthcare, for the people up there, and for down East Maine, for me in particular, personally.
I think I went there to listen and to witness like the different cultures, and I think like being patient and listening and developing empathy are things that any of the health professionals should acquire. And this experience is definitely a great way to do it, and to work interprofessionally with wonderful people, like Peter said, is great.
One of the things that I noticed even getting to know each other is how it really does take a long time to establish what the space feels like, that you feel comfortable revealing things about yourself. And I think it was interesting to me how, for almost everybody, it's actually really emotional to really tell your story, even just the facts about your story. And I think that that's something to keep in mind in a 15-minute visit with a patient. How much else is there, but also respect for, it's not easy always to create it, for either one of you, the provider or the patient, to feel safe talking about yourself in a deep way. So, but yet it's a really crucial part of your health. So I'm going to remember that.
I have a question. You talked about you went to a hospital or a clinic. Can you talk more about that and the healthcare professionals that you met with there? Anyone?
Yeah, it was a patient-centered medical home. So the population of Eastport, I think, was 1,300. There's not much in the town. So this patient-centered medical home basically has, whatever the town has to offer all in one spot. So we met with Holly DeYoung, who runs it. I think she was a nurse, right? Yep, nurse practitioner. So we met with her. I think we spent the entire morning with her, and she kind of talked about issues they face up there with funding and because it's a widespread area, just like on Pine Point or Pine Ridge, the transportation is an issue for some people. So yeah, Holly was great. She actually invited us to her house afterwards. It was St. Patty's Day. We had like a little St. Patty's Day party at night. So yeah, I can't remember. You don't want to? Yeah.
So I had actually just recently completed the IPSAT clearing on case competition, and that was one of the things. That was my group's intervention, was the PCMH, and being exposed to that very soon after, because I had no previous experience with the patient-centered medical home, was awesome. And then they actually had included the community model as well, and so to see it brought home full circle in the case competition, and then up in down east. And then to be able to go to her house and meet with other community members, other healthcare professionals, and to see that they communicate, they all know one another, they're all friends, and it made me think, what that really does for patient care. If you can communicate with someone on a very, communicate with your friend about someone's health, what does that do for communication when I'm talking about a patient? Lines are much more, they're opened up, and I think miscommunication has a less of a prevalency to occur. Sure. So I actually have the opportunity to go to the Passamaquoddy Reservation and to their health center on my 7th rotation for my clinical year, and it's a one-stop shop for pretty much everything. They have an emergency room there, which is kind of like MASH. They have the different partitions set up, and it's very basic stuff that they have there. The community ambulance on the reservation will come pick up the patient and bring them to the healthcare center. They have a dental clinic there as well, and their dentist is out. He's actually ready to retire, so they're looking for someone to move on up there and take on his role. I don't know. Was there anything else?
They had PT.
Yeah.
Doctor. Yep. So they also had PT, massage therapy, optometrist, acupuncture, social work, pharmacy. They also had a child and adult psychologist, I believe, nutritionist. And I know all the professions that we're shouting out, you would think it's a big place, but it's not. It's probably, I'd say maybe twice the size of this room altogether, maybe. But they're same thing as Pine Ridge, understaffed, underfunded, and their turnover rate is also really high. Ange?
All the medical professionals that you just mentioned, where did those come from? 'Cause I'm assuming that they didn't grow up there. They probably came somewhere else.
I believe. Oh, yeah. We've talked a little bit, or been talked to a little bit about the tuition forgiveness programs, where you go to an underserved population. So some of them are there for that. I would imagine some of them grew up in the local area and then came back home. I think some of the nurses or CNAs might have been Passamaquoddy, but overall it was mainly white people that were working there.
Well, it was suggested that if any young person goes there, go there with a companion because it gets lonely over there. And that was the only suggestion they gave us as far as if you do want to move up there. Yeah. Questions?
As future healthcare providers and professionals, what specifically did you learn about the Passamaquoddy culture and health beliefs that you would want to integrate into your own clinical practice and want other colleagues to know about as they're working collaboratively together with a Passamaquoddy patient?
It was a slight difference, but the thing that ran true through everything was that they wanted more of an open line of communication as far as all the practitioners, whoever's dealing with that patient, to be on the same page with that patient's outcome. So it wouldn't be any type of miscommunication as far as that. That's why I asked one of the nurses, she said that when a patient gets checked in, everybody knows what's going on with that patient, from the eye doctor to the EMT who brought him in, to the nurse who's checking him in and everything. So even like us, when we get into our practice, not on the reservation, we still have to make a conscious effort of discharging properly, checking in with the nurse. From my standpoint as pharmacist, make sure the dosing is right, make sure the patient adherence is right. The doctor, you have to get in contact with the doctor still, follow-ups, all that stuff was reiterated on the reservation, and I think it still will happen outside of the reservation also.
As far as culturally, I didn't really notice a difference as far as, not wanting certain procedures or not wanting certain. I think that's what you were asking. Yeah, as far as culturally goes, and we were at the health center for maybe an hour, and we pretty much spoke to two people, and one was Passamaquoddy, one was not. So I don't think, I'm from Pennsylvania, so I know Amish people refuse any type of surgery. But as far as anything like that, we didn't come across anything like that.
And for the Passamaquoddy in general, I forget what the actual term that's used, but essentially it's a wellness circle, and for them, health is just one aspect of that. It's so much more than just the medicine. Their health encapsulates so many other aspects that that's not the focus of what our profession is. So respecting that and realizing that they're just not looking for medicine. There are other avenues that they believe their health overall is tied to.
I'm so proud of all of you. Thank you for telling your stories. It's not always easy. One thing that we started talking about in the art gallery at the very beginning was about the power of personal story and about how there are multiple stories to tell. So I want to know who else you're going to tell this story to and how you're going to share your stories going forward after this day.
Well, I guess I've already told the story to a lot of my classmates because a lot of them knew, what was going on and why I was going, and when I came back, they, wanted to know what it was like and what it was all about. So I've kind of told the story a little bit, and also my mom was hampering me for all the details. But yeah, I think like the issues that I talked about today with Pine Ridge, this is an ongoing problem. It's been ongoing for 200 plus years. I mean, if you want to talk about the arrival of Columbus, it's been going on for way longer than that. And I think it's issues that need to be addressed, like the health disparities and the income disparities are really, really horrible. As far as what I personally can do, I don't know. I was hoping you were looking for an answer to that. I honestly, yeah, I don't. Just go along in my practice and try to give the highest quality of care I can and advocate for people when I can. And other than that, I think personally, I'm a little bit, my hands are tied,
Just like my mother, I talked to my mother about the story also. My mother's a social worker. So when I told her I was taking that course, she said her eyes lit up. When she hears cultural competency, she loves that. She's taken plenty of courses on that. So she said, I'm glad that other programs are introducing that concept to you guys, so you guys will, she's a lifelong advocate. So when she heard that, she said, I'm glad you guys are getting introduced to that in your program. And she just touched base with understanding that cultures are different, and you have to realize that when you're practicing, and it doesn't matter the profession, you have to understand that everybody does things different. And I think I told you guys a story before that my mother had a patient once that refused treatment for cancer. And when she told me, I said, what sense does that make? She said, Peter, you have to just understand some people don't want to treat cancer. They just take it as is or whatever. And she says, but my viewpoint on them didn't change. I still have to work with them as a patient. And I think when she tells me those stories and I hear the stories that we just all got introduced to, I think it's a matter of just understanding that everybody's different, but we're all alike in so many different ways. And it's just a matter of understanding where everybody's coming from. And in my practice, I plan on using it too. I want to do industry pharmacy, but more specifically work with advocacy and policymaking with drugs. So a lot of my career path could lead into emerging markets. And I believe understanding emerging markets is very essential to having like good healthcare models, so to speak. So I'm excited about that. I don't know if anybody else wants to talk. The ladies don't want to talk today. I don't know.
The experience taught me as a whole not only how to tell a story, but how to listen to a story, and how each and every one of us has a story, and how to appreciate the stories as they come to you. And really, you can get all the information that you want just by asking the right questions, and by knowing or almost anticipating, or rather expecting that everybody's story is different, you will know how to ask those questions. And I think we'll be better healthcare professionals because of this experience, and I thank you for that opportunity.
Any more questions? Well, thank you guys for coming out. We really appreciate it. Thank you so much.